My deepest wish is for people to understand that deaf people are just like everyone else. They are just people. I've found the systems in Colorado to be difficult because of this one thing.
Properly, and the areas that she was living in, there were no interpreters, there was no one there to help screen her medication.
One of the biggest challenges was recruiting people who were bilingual in signed English and American Sign Language, and we eventually hired 2. But that was a long task to get there.
It's 30 years after the ADA, and many of us can't get services. We can't hear. What are you going to do? Would you go to another country and go to a doctor that you couldn't understand? What if you had appendicitis? What if you had a nervous breakdown or you know, you needed new drugs for your mental health issue? Would you go in that country to a doctor that you couldn't understand? Well, that's what all of us do in America.
One is a wider point that mental health in general, human services as a whole, even for hearing people, are available. They can choose any and every service that they might like to access, whether that's children, middle age, or older, for one-on-one direct service. For people who are deaf and hard of hearing, I'm not saying they're limited, they're almost non-existent.
The population that are underserved, who have a co-diagnosis of hearing loss and mental health issues, has grown considerably in the past decades, according to National Public Radio. Hearing loss tends to isolation, which causes major depression and anxiety.
A study from the National Institute of Drug Abuse. In 1980, there was a startling 206,200 deaf people with substance abuse.
Do not understand, or do not hear in order to understand, or do not know how to practice empathy and compassion in order to understand. My point, do not understand.
I was diagnosed with depression in college. That's my second disability, and I tell people on any given day, it's easier to deal with being deaf than being depressed. And dealing with being deaf is hard. So,
You know, a personal story of mine, about 10 years ago, I had a full-time job, I had insurance, and I experienced depression. I was seeking counseling services. I reached out to my insurance company and asked if they had counselors for individuals who were deaf. And they said, yeah, we sure do. And they're hearing, but I asked if they said we could provide an interpreter as well. And I'm like, you know, that's not a good fit for me because, again, a hearing therapist doesn't necessarily have a functional knowledge of deaf culture. I wanted a counselor who was deaf or had an understanding of deaf culture. Then being aware of mental health services that are accessible, people who have deaf children, and people who speak Spanish with deaf children, or any other language for that fact. We also need to make sure they have access to those services